Okay, are we ready, circulator?
Yes.
Are you going high and I'm going low? What are we doing?
I'll go low if you want me to.
Okay.
I'm the short one.
Alright, so we're going to start wiping the room down. I start with the OR lights.
Y'all might want a video, just saying.
Sydney's our videographer.
Okay.
Don't forget, you guys would normally have your hat and your mask and stuff on.
Yeah, we're not having all that on. Alright, so I'm doing my lights. You also want to do the poles of the lights. These lights were not put up here correctly, so they won't hardly swivel like we want them to. Alright, tabletops. Going around the rail, top.
I'm doing all of the horizontal bars, not the vertical bars. So all of these, but not these, okay? If y'all don't know horizontal and vertical.
And you notice she's following behind her. She's not going in front of her.
And letting her,
Dust fall back where she's already wiped.
And y'all see I didn't push that mayo stand all the way back in the corner. I can't stand to see y'all do that when you're opening the fields and stuff, because that means when the scrub tech's trying to set up, they're having to go way back there in that corner and their back's getting to their fields and stuff. So kind of just leave that mayo there. Your table's on wheels. You can move stuff around if you have to. I'll get this side of the bed.
the beds always last.
Alright. Dirty hands. Then we go and we wash our hands for how long?
30 seconds.
30 seconds. There, you don't really have it. And just use regular hand soap, not your surgical scrub soap. Fingertips down, Brandy. Fingertips down. Alright. Okay. So she's now gonna go get the preference card and go through the preference card and open the step. I'm going to get my gown and my gloves and I will open them on this mayo over here. Alright, so she's going down that preference card in order that it is on that sheet.
This is all stuff you guys have already seen and done.
Alright, I've got my gown pulled to the front of this mayo because this is one of the big mayo stands. I want to make sure that I've got my corners covered. Yeah, my corners are nice and covered. Opening my gloves. And now I would be scrubbing my hands for 6 minutes.
Okay, gone through my preference sheet. These are all my open items. Set this up.
They have not been shown how to open stuff.
Okay. So the first thing I'm gonna do is open my pack. The first time you open these, which will be every time in the OR, it's not from the top. It's a weird package. So you pull right here at this kind of inside corner. So this is a wrapped item inside a sterile package so I can open it and touch it. This, in the OR, this would be trash. We are saving it in here. I'll pull my table away from the wall. Tear this little seal. Open away from me first. Alright. I've shown y'all how to open these packages. These things we are going to remove from the package and give to our circulator. Now, can y'all see that's opening this way first? So I'm not gonna come right here and get myself backed into a bad situation. I'm gonna make this work for me. So I'm gonna move this out. We're also not gonna come up here and open this. You need to stay on this side of the table. I'm short, so if I can do it, y'all can do it. Grab the edge and don't grab it real delicately. Get a hold of it. Come down with it. While I'm down here, I'm gonna grab the silver part, the metal part of the table, and move it back into place. Now I'm gonna be exaggerated on my movement, come around here, make this side work for me. I'm gonna come down here and move my table back into place with the metal.
See how she's not leaning over her build when she's standing up and stuff like that? She's going straight up. She's not leaning forward, so she gets over the top of her sterile field and everything.
When you're doing this, it's real easy to start doing this when you come up. Watch your head. Don't get your head close to this. Okay, I'm gonna come over here, open my supplies. We have pop-off sutures that y'all are gonna open this time, which is a multi-pack. We count our multi-packs first.
The gloves she's opening now are the surgeon's gloves.
Okay. These lap sponges are a wrapped item inside a sterile package. So I'm gonna open it and reach in and grab it. We're gonna open this like you do your gown on your mayo, except we're not laying it on a flat surface. So I'm gonna have it in my hand and open the first flap away from me and tuck it in them fingers. If you don't tuck it in them fingers, it's just gonna start going everywhere like this. So I'm gonna stay facing my field, tuck each flap in my fingers, and when you open it, kinda come up over that corner. Don't just come across and let your corner get snagged. So I'm tucking that one into my thumb. I'm gonna pull the last one down and I'm gonna hold it and toss. Wait. Okay. We're gonna wait on our water till she gets scrubbed in, our saline. I'm gonna stay facing my field. Give the circulator the inch. Well, I am the circulator. Put that in my pocket. Check our little locks and everything. Rock and roll with it. No holes. I see no moisture. Indicator's flipped upside down. So I'm gonna let my scrub tech check that indicator when she gets over here.
So she would tell me before I went over there, hey, I can't see your indicator, you're gonna wanna make sure that you check it. Remember, in the OR, most places the policy is that you double glove, so when you're over here putting your gloves on, you'd be putting 2 pair of gloves on. We're not gonna do that in here because it's too wasteful for y'all to use 2 pair of gloves and everything. But if I went over there and I checked that indicator and it wasn't sterile, all I would have to do is drop the indicator and my circulator could come take my outer gloves off, and then what's underneath is still good. Oop, I got a watch on and all kinds of jewelry.
But as a circulator, could I check her indicator since it's upside down?
No.
Okay.
Y'all see me flapping like I was really wet, that's just like a routine.
So the circulator is now responsible for tying up the scrub tech.
Y'all see how I'm staying away from my mayo stand? I'm not even anywhere close to it.
And y'all see how she's going ahead and moving forward with her gloves while I'm doing this. Y'all are gonna be timed. So your time starts when you pick up the towel. So you don't want your circulator tying you up to interfere with your time. So you're gonna continue working.
Alright, so now I'm going in. My first priority is I've got to get this pan of instruments, so I need to make a spot on that back table for me to set those instruments. Where do we say those laparoscopic instruments are going to go?
Far left corner. Far left corner.
Alright, so this stuff I'm just picking up and I'm going to move on top of all these supplies and just kind of scoot this over to the right. If my table's not real smooth, I'm gonna try to smooth out any wrinkles or anything on the top of my table so it won't be all bulky and everything when I go to set my stuff down. You see how I wasn't doing like this, right? Can't do that. My hands have to stay at table height. So I'm coming to get my pan of instruments. She's already told me I need to check my indicator, see how far away I'm staying from the pan, because all of this is unsterile. I need to be careful too when I'm reaching in this pan to get my instruments that I don't let my sleeves touch the edge of the pan or anything. So everything's pretty exaggerated. All right, they're good.
Okay.
So look how I'm holding my hands to reach in here so my sleeves don't get to the edges or anything. All right, I'm reaching in, I'm grabbing my instruments, I'm holding them out and away from my body, because if the bottom of that pan's not good and I was resting these right here, what'd I just do?
Contaminated.
All right. So
Good.
I'm sitting here, she told me they're good. Could I sit here and hold them over my field until she told me they were good?
No.
No. All right, so she said they're good. So I'm gonna set them right there where they're gonna go. I pushed them all the way to the left corner. I still have another pan of instruments I've got to get. So I'm digging in here and I'm looking for a table cover that I don't have. So I need a
The
table
package
cover.
said it's in there.
I think they're counting this as your table cover.
Okay. So, since she scrubbed in and can grab this table cover, I could either open this the way I did the lap sponges a minute ago, or I could open it like this and let her reach in and grab it. I'll go ahead and go. That's not looking too good.
I can't stand it when people try to give me stuff and it's got all that trash on it. In an emergency situation, when you're trying to move real fast and they come up, you don't want your lap still in the paper and stuff. But I could have taken it that way. All right. I've got to drape this table out. There's nothing sterile, right? On this, I've at least got the front of this so my gown could get close to the front of this table and everything. Over here, there's nothing sterile on this table. This table cover is folded kind of like a book. So you need to open it where you find the center of your book, okay? When I come over here, I'm staying away from the table. I'm gonna lay it down like this, not let my hands get close to it, okay? I'm keeping my hands on the top. I'm grabbing what's right here on the top. I'm opening it to the right first, letting it drop. Now I'm gonna do the other end. See how I'm not opening it up straight high and making a big deal about it dropping and flapping and all that? And I'm dropping it from here. Since I'm on this end, I'm gonna cover this side of the table first. You always want to cover the side that is closest to you first, because you want the side that's close to you to be sterile, correct? All right. I'm pinching this at the very end of the table and I'm getting under this front edge of the table cover. I'm pulling it out like this, keeping my hand up, and I'm letting it drop. I'm gonna come down here, do the same thing. I'm grabbing right at the end of the table and pinching and pulling straight out. This is what y'all are gonna wanna do and what I'm gonna get you on if you do it. You're gonna come down here, lift up, and see how it flopped and everything that was low came up. I'm gonna get you for that. I want you down here. If I grab this front edge at the very end of the table, when I pull it out, all that stuff that's low isn't coming back up on top of my table. Making sense? All right, now I've got to cover the back of the table. I'm gonna put my hands on the table, push down and pull it forward because I don't wanna touch the back of the wall with my sterile drapes and everything when I'm draping it. Again, pinching right at the edge, at the end of the table, sliding it straight out, letting it drop. Same thing over here, pinch, slide straight out, let it drop. My hands never went below table level, okay? Now I'm gonna push this back to kind of get it out of the way so it's not in my way when I'm trying to walk around. I'm gonna come over here now and get this pan of instruments and see the indicator. You see when I'm dropping it, I'm not letting my hand go down low. Picking them up, holding them away from my body.
Filters are good, there's no moisture.
So I'm gonna set it down. Now I'm gonna come over here and all this stuff is gonna need to go over to the corner of that table.
And I'm not leaving this stuff here because we got a patient on the way. So you need to pick all this up.
I'm gonna leave 4 towels over here at this main table. Everything else I'm taking with me. So I'm taking the gown, all these towels. Here's that large drape that I told you will go across the patient's legs. I'm taking my laparotomy drape, and I'm taking the surgeon's gloves with me. Okay?
Don't forget your mask uncovered.
Oh, yeah. And I'm taking that with me. Alright. I'm coming over here. I'm not gonna arrange this stuff right now. This is stuff that's a luxury at the end of the case. If it's a trauma, you don't care if your gowns are stacked in order and stuff, right? You want your instruments laid out so you can get to a knife if you need it. See how when I'm walking, I'm facing my tables the whole time? I'm not moving and turning my back to them. Right now, I'm just gonna push this stuff over to the side and towards the front just to get it out of my way so I can set my instruments up. I'm making a roll towel to put my laparoscopic instruments on. To make a roll towel, you just fold these towels, or unfold them in half. I'm gonna get 2 because these little towels are kind of poopy and they're real thin. But I'm gonna get it and I'm just gonna roll it so I've got a place to put my ringed instruments. These 2 extra towels are gonna be here for if I need them during the surgery. If the surgeon needs one for me to lay something on or something like that, I've got them. All of these cords and stuff, I'm gonna take out. They're kind of in here poopy, but I'm gonna set them right here while I'm setting this stuff up. My ringed instruments are right here on top, so I'm gonna grab them and I'm gonna place them where they go. I'm not gonna get stuff out and lay it here to move it over here, to move it over here. Once I pick it up, I'm gonna put it where it goes on the table, okay? So these stringers that your instruments are on, you can get them and just tuck them back here behind your instrument pan to get them out of the way so they're not bothering you when you're doing the case. My scope is gonna kind of go with this light cord and this camera cord, so I'm gonna put it right there together. My S retractors are gonna go up here. All my pickups and stuff I'm gonna kind of put right here by my instruments. They're kind of just thrown in here willy-nilly. I don't know where my other debakey is, but hopefully we'll find it in a minute. These towel clips I'm gonna put down here in the corner where this little flap for the instruments goes. Finding all kinds of stuff in here. Sin retractors I'm gonna put up here by my S retractors. Here's my other debakies. All right, all of these I'm just gonna kind of pull out and I'm gonna arrange them when I get the stuff. And since these aren't standing up, I'm gonna put them over here on my roll towel. They're too little, they're tiny. All right. When I do laparoscopic cases, I like to make sure that I separate my scissors from everything else. When you're doing a laparoscopic case, it's in the dark, all right? So sometimes it's kind of hard to see the tips of your instruments and stuff. I don't want to accidentally give him a pair of scissors or give him a tenaculum forcip or something like that, thinking that it's a non-biting grasper. Okay, so I separate my stuff just so I don't grab the wrong thing. I also separate my ratcheted instruments from my non-ratcheted. I'm not saying you have to do that. I'm just saying that's a preference that I like to do. I try to keep all of my dissectors together.
Y'all understand why, right?
When it's in the dark, it's really hard to see
We don't,
stuff.
like, cut through the liver instead of grabbing it. Did you look like me? No.
Oh.
Your buddy.
I'm putting all my stuff that doesn't have a handle kind of down here on the end. And these big needle holders and stuff aren't gonna wanna go where I want them. All right, so I've got this laparoscopic pan arranged, kind of how I can work with it and everything like that. Now I'm gonna come over here and I'm gonna arrange my large lap pan. With this one, you're gonna need 2 sets of roll towels, because you're gonna have towels for your long instruments, and then you're gonna have towels for your instruments that are kind of on the stringer. So again, just fold your towels in half. You're gonna wanna do kind of a tight roll. I'm gonna put one right here for my stringer instruments. You see when I'm working with these towels and stuff, I'm not letting them drop over the table edge, and see how I'm keeping my body close to the table. Now that you're in the scrub roll, you can get close to the tables. When you're in the circulator roll, should Brandy be this close to the table? No. So as a scrub, we want you staying close to the table. And did you see how when I'm moving around that OR bed, I'm staying away from the bed? When I came from over here, I'm not stepping back like this and hanging out by this bed. I should stay close to all of the sterile stuff, right? When I'm moving around. All right, now I'm gonna start setting all this stuff up. When I pick it up, I'm putting it where it goes. When you're working with these little wire stringer things, they're glove eaters, so you wanna be careful that you don't pop a hole in your glove. I push from back behind the spring and then just slide it out, and we'll show y'all that when you practice. You'll be able to do it closer. I'm just gonna put these back in the back of the instrument pan. All right, I know that when I'm counting, the last thing I count is gonna be my scissors. So this ends with the scissors right here, so I'm gonna put them on the right side. I start with my cokers, so I'm gonna put it right there. That laid out and ready. All these retractors for right now, I'm just gonna take out of my pan and set them over here so I can arrange them the way I want them once I get them inside there. Your suction tip with the guard is gonna wanna go over here and be held kinda in that corner by that handle. My debakis should have been in order when somebody set this pan up for me, so I should be able to just pick them all up and put them there. Same thing with all my pickups with teeth. I'm gonna kinda separate them a little bit, so when I'm counting them, the circulator can see that they're not all the same pickups, okay? There's a rogue debaki. It's gonna go right there. I'm just leaving these ribbon retractors in the pan because they're gonna be to the front of the pan anyway when I set everything up. Hemoclip pliers, you're gonna wanna make sure when you set them out that you put the tips up, that the tips aren't facing down on the table, because we don't want them to accidentally puncture and make a hole or something like that on our table. Alright, all these retractors. I don't care which order you put them in, as long as you have everything that's alike together, okay? So I want all your Devers together, your Harringtons together, or your Harrington. Your Richardsons are gonna go together. Army Navies, you're gonna kinda let the drape over the back of your instrument pan. They're not hanging over the back of the table, so you can see I've got them hanging on. If you will put the long end over, they'll stay there. Alright, so now I've got this set up. Now that my instrument, oh, except for my towel clips. Towel clips we put over in this corner right there. So hopefully they'll stay right there. Okay, now I'm gonna come over here and arrange my supplies.
You'll notice that she did not touch that pile of stuff yet. The only thing she's focused on right now is all the items that we have to count, because that's the most important, because her circulator needs to be freed up to go help the patient. And her circulator is gonna have to help her count. So everything she's doing right now is to get her circulator freed up as quick as she can.
When I'm passing trash off of my field, usually in the OR, there's gonna be a trash can somewhere close to you, all right? So you could drop your trash in it and stuff. Your circulator ain't gonna be standing there waiting for you to hand them trash.
I'm
But-
sweet.
When I pass stuff to her, see how I keep my hand up high and she's grabbing from the bottom to take stuff from me.
So my dog hair don't fall on her.
Yeah. This is all stuff right here that I'm stacking, these cords and stuff. It's stuff that's gonna go on top of my Mayo stand later on, so I'm going ahead and just putting it all in a pile. My lap sponges are gonna go in one of these bowls, so I'm just sticking them in it. This other bowl is gonna have my Raytex sponges in it, so I'm putting them in it. This little pocket drape right here is called a 1018 pocket drape, and so during the case, the surgeon's gonna put his cautery pencil down in there, maybe the suction tip, maybe his favorite pair of DeBakey's, or something like that. It's kind of like a little pocket protector. I'm gonna stick it here with all the stuff that's gonna go up on top of my Mayo stand. This is that disposable insufflation tubing that I told you guys about. You know, I told you some places are gonna have reusable, some are gonna have disposable. So it's gonna go with all these other cords, so I'm stacking it here with my light cord and my camera cord and all of that. Disposable cautery cord. Remember I told you ours is reusable? This one's disposable. This is a little trash bag for us to use during the procedure if we need to throw anything away. I'm not gonna really stick it, but it's gonna go right here at the edge of your table. You'd pull the paper off and stick it down to your table. Medicine cups, I'm gonna put right here. You want them up to the front, so if your nurse needs to go and pour any medication on your field or something like that, it's right here by the front edge. She's not having to reach across your table and everything. I'm gonna put the lids to the medicine cups right underneath each cup, so that way if I've got a specimen or something, I've got the lid to put it in. My labels and my marking pen are gonna be right there by the medicine cup, because anytime I get a drug on my field, I gotta label them. All right, so everything that's gonna be used together, I just kind of keep it together. Sharps box, gonna go in the left-hand corner. This little thing, remember I told you about the scissors where they get new tips and stuff? These are my scissor tips. I'm just gonna put it in my sharps box, because I'm gonna have to count that after a while. My trash is going in my little handy dandy trash bag I have right here that's not stuck, that may hit the floor. This is the Fred solution. We have to count it, so I'm laying it up here. Again, trash, I'll just stick in the back right hand corner. My suture, I'm putting it back here. I do not take the front piece of paper off of this suture until I'm ready to count, so my circulator can see it. With this suture, there's no reason for me to pull the paper off of it, because she can see the needle that's already sitting there. All right, so I'm placing all that stuff right there. Right now, I'm set up so I can look at my circulator and I can say I'm ready to count. So she's gonna come up, she's the one that leads the count. I just follow whatever she tells me to do. I'm doing whatever my boss lady tells me I need to do.
And I'm staying away from her field. not gonna get up here. Even though I have to see what she's counting, I have to stay away from her field. So we always start with supplies. So laps.
All right.
This is what I wrote on the board during the counts lecture. Laps.
All right. So I didn't take the paper band off of my laps until she told me she was ready to count them. Putting my trash back in the right-hand corner. I have to unfold them where she can see the blue. I want to make sure when I'm counting them that this doesn't happen, right? So I'm going to put them back here a little bit. 1, 2, 3, 4, 5.
And y'all need to count together out loud.
Oh, this one's double banded. Fancy. 6 started a whole separate pile. Okay, I'm not stacking them on top of each other. 7, 8, 9, 10.
So I write 10 by my L, and you know she stopped at the 5 and started a new stack because they come in packs of 5.
So if I had 20, I'd have 4 little packs, 4 little stacks of 5.
Raytech.
All right, pull my paper off of the Raytech. When you're counting the Raytech with your circulator, the easiest thing to do is you can see how there's a blue radiopaque tab towards the end. You don't want to pick them up where it's in the middle. You want to hold where it's closest to the end. This is the folded end of the sponge. If I try to grab down here to count them, the sponge starts to unfold and everything. So you're going to want to grab the sponge by the folded end. I'm going to completely separate them when I count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Needle.
Count your multi-packs first, remember? So since this one's covering, this piece of paper is covering the needles pretty much, I'm gonna pull it off. This is gonna go back here in my trash pile, but there's a little tab right here on this thing that tells me what type of suture this is and what type of needle it is and all of that kind of stuff. Oh, I did have one right here. I've got instruments hiding. All right, I like to use my knife handle to count with. I don't like putting my finger by the sharp tips of the needle, and I think it's harder to see if I got my fat little finger when I'm counting, so I use a knife handle. You don't have to use a knife handle if you don't want to. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9.
Blade. 0.
Yep.
Bovie tip.
1 with the guard. See how this guard comes off, so we have to count it.
Do y'all know why we don't have the blade yet? Y'all remember?
Because it's not till the first incision. Or you have to do all the counts before the first incision.
What do we have to do before we get a blade on the field at Baptist? The timeout.
That too.
That's why she doesn't have a blade, because we haven't done a timeout.
At the pavilion, they're gonna give it to you right at the beginning. So it's just gonna depend on,
Where you are. Injectable.
I don't have one.
Alright, scissor tip.
1. See how I'm holding it up so she can see it?
Thread.
Have a pad. Some of your circulators are gonna count the bottle and the cap separate. Some of them are gonna count it together. So ask your circulator, how do you wanna count it? As 2 or 1?
Do you want them to, how do you want them to do it in here?
Let's do it as 2 pieces, so we make sure we got our cap back. So we'll have 3 pieces all together with Fred.
Okay. Alright, is that all your supplies?
Uh-huh.
Now we're gonna go to the instruments and stay in order on your sheet. Alligator grasper.
Alligator grasper. I have 1.
Babcock.
1.
Non-ratcheted grasper.
1.
Dolphin nose.
1.
Hunter Glassman.
Where'd you go, Hunter? 1.
Prestige.
1.
Maryland.
1.
Needle holder.
1.
Clip applier.
1.
Endo shears.
Endo shears. 1.
Aspiration needle.
1.
L hook.
1.
Spatula.
1.
Knot pusher.
1,
5mm laparoscope,
1,
camera cord,
1,
light cord,
1,
S retractors,
1, 2,
sin retractors.
1, 2,
Alright, knife handle,
1,
debaki,
have 1, 2,
platform tissue with teeth,
1,
and platform Adson.
1, 2.
Okay, on the stringer.
All right, so when I count my instruments on the stringer, see how I'm moving my body over so she can sit there and she can look across and see. I'm not standing here right in front of it so she can't see anything. So I'm
I did
kind of
that as a
angling.
student once, and the nurse printed me off a policy count sheet before I left the room that day. Coker.
I use my knife handle to separate the tips of my instruments because it's easier for me to see what I've already counted. 1, 2,
Alice.
1, 2,
Peon.
1, 2,
Hemostat.
1, 2, 3, 4.
Needle holder.
1, 2, 3, or 2 short, 1 long. I don't know how that sheet is. Ours are all different sizes.
Okay. Metzenbaum.
1,
Mayo.
1,
Towel clamps. Biting, or non-biting first.
1, 2,
And biting.
1, 2, 3, 4.
All right. We're ready for the large lap pan. Ribbon.
1, 2. See how she can see through the front of this pan to see that I've got.
Deaver.
Deaver, I have 1, 2, 3. See how my hand's up here? I'm not standing here like this.
If I needed to angle, I would not step here between her two fields. If I needed to, I would come back here and get on this side. Harrington, did I say that already?
1,
Richardson,
1, 2, 3.
Eastman,
1,
Army Navy,
1, 2,
and Rake.
1, 2.
Pickups, Bonnie,
1,
Platform of Teeth,
1.
DeBakey's.
I have 1, 2 long, 1, 2 medium, 1, 2 short.
Adson.
1, 2.
All right, knife handle. My bad. Abdominal section with guard.
Section with the guard.
All right, knife handles, number 3.
I have 1, 2 short, number 3.
Okay, number 3 long,
1,
and a safety.
1.
On the stringer, sponge forceps,
1, 2.
needle holder,
1, 2, 3.
tonsil clamp. Oh, sorry, Mets,
1.
right angle.
All right, so she told me tonsils, my Mets were next on my sheet. So all I was gonna do was pick up my tonsils and move them to that thing. Sometimes they're not always gonna be in order because the person putting the pan together accidentally skipped over them or didn't get it in order or whatever. You just look to make sure you've got whatever she's saying and show it to them, okay? Don't let it frazzle you because some of y'all are gonna put the pan together and then somebody else is gonna have to count the pan you put together. Just keep on rocking and rolling when that happens. All right.
Where did we leave off?
All right, so you said Mets, got it.
Tonsil clamp,
1, 2,
right angle.
1, 2.
Kelly,
Make sure you're checking the tips. 1, 2,
Coker,
1, 2,
straight intestinal,
1,
curved intestinal.
1.
On the rack, straight coker,
1, 2, 3, 4.
curved coker.
1, 2, 3, 4.
Alice,
1, 2, 3, 4 short, 1, 2 long. See how I specified the difference? I don't want to just say 6 because if I only have 5, which one am I missing? Is it a short one or a long one I'm missing? All right.
Babcock,
1, 2,
tonsil,
1, 2,
right angle,
1, 2,
Kelly,
1, 2, 3, 4.
hemostat.
1, 2, 3, 4, 5, 6. She should be watching me, and she is, because if I miscount something, she's going to call me on it and say, nope, you skipped one or something like that. And she needs to make sure whatever I'm counting is really what I'm counting.
Needle holder,
1, 2 long, 1, 2 medium, 1, 2 short.
all right, scissor, long curve mayo,
1,
short curve mayo,
1,
straight mayo,
1,
Mets.
1 long, 1 short.
All right, penetrating towel clamps,
have 1, 2, 3, 4,
Non-penetrating.
1, 2.
Hemoclippa pliers.
I have 1, 2 medium, 1, 2 large.
All right, count is complete.
All right, so since we've done all the counts and everything, it's time for me to go ahead and set my mayo stand up.
While she's doing that, I have to go over here to this board and write the supply count down on the whiteboard. And your nurse should always do that immediately.
Okay, this mayo cover is folded how you can put it on, in a way that you can get it on sterilely. You're gonna wanna unfold it like this, and you're gonna wanna make sure where the sticker is with the writing is up on top. And it's telling me, place my hands under the cuff. So you've got this little cuff on the outside layer. So I'm gonna slide my hands in there, and when I get them in there, I'm gonna feel a bunch of folds. With 3 fingers, I'm gonna grab a hold of those folds and hold them, and then I'm gonna roll my hand up like this to make a big mouth with the mayo drape. And I'll show you what I'm talking about. So I grabbed it, and then I'm coming in here, and I'm making a mouth like that so I can slide it over the front of the mayo stand. See what I'm doing? See how I'm holding it all so it doesn't fall down? This is like fan folded, so if you're not securing all these folds, it's gonna fall down on you. I'm gonna come at my mayo stand, grab it. Once I get my hands around it, I can pull it out towards me. I'm putting my foot on the bottom so it doesn't walk away from me, okay? I'm gonna secure these folds, and I'm just gonna start pushing this drape onto this mayo stand, and I'm slowly letting it unfold as I'm pushing it on there. This one's going on this mayo really easy because this is a little tiny mayo, which y'all are gonna be using the big mayos. All right, so I put it on there as tight as I can get it. I'm pulling all the excess of the mayo drape to one side, and I'm gonna tuck it underneath because I want this to be really neat and tight, so I don't have a bunch of stuff hanging over the edges for me to grab or instruments to fall in and stuff like that. Now I'm gonna put the stuff up on my mayo stand that I'm gonna need to start the case. What's the first thing I told y'all you're gonna need? Knife.
Can I give you some saline?
Sure.
So while she's doing that, the circulator's gonna stay away from her field. This is considered sterile as well. I'm gonna make sure she sees it. 0.9% sodium chloride. It expires May 2026. The warming date is May 2025. Breaking the seal.
I don't have a picture just pour it in there.
My bad.
And while she's pouring that, and I don't forget it, I'm gonna go ahead and fill my asepto syringe up, okay? So, this is, you'll hear it called an asepto or a bulb syringe. To fill it up, you're gonna wanna squeeze the little green bulb. While it's squeezed, you're gonna stick it inside your irrigation and you're gonna let it unsqueeze. You're gonna flip it up again, squeeze, stick it inside there, let it suck up more irrigation. Usually it takes about 3 times to fill it up.
And irrigation has to be labeled as well.
Yes, I would label this 0.9 sodium chloride. There's a sticker right here on the side of the bowl, and then I would write it on this bulb. Are they letting them write, or is the glue ink coming off in there and they're having a hissy? Who knows?
I do not know the answer.
Depends on the doctor.
Okay. So I've already got that filled up. All right, I got my knife. What else did I say I'm going to have to do this surgery?
Scissors.
Oh, I'm hearing all of the answers. All right.
DeBakey's.
I'm going to want 2 hemostats. I'm going to want 2 DeBakey's, one for the surgeon, one for the assistant. Medicine bombs and Mayo scissors. Got them. What's the last thing I need? Retractors. So on this, since we're doing a laparoscopic case, I'm going to start with these S retractors. So I'm going to come over here and I'm going to set them on my mayo in the order he's going to use them. The first thing he's going to do is cut. Usually I always put my pickups next. When you put your pickups on your mayo stand, I'm trying to get where y'all can all see. When you put them up here, you don't want to lay them up here nested like this, because when you grab them and try to hand them to him, you're going to end up getting both of them, or one of them's going to go flying or something like that. So you're going to want to separate them when you put them up on your mayo stand. I always put my scissors next. I don't care if you put your Mets first, your straight suture scissors, it doesn't matter. I put them next. Then I put my hemostats up. When you put your hemostat up on your Mayo stand, you need to click it one time, okay? You don't want to give them to him in the open position because when you go to pop them in his hand, they're going to wiggle and all that kind of stuff. He's not going to like it. So I'm going to lay them up here and I'm going to stack them on top of each other because they're the same thing, okay? If I grab 2 Kellys, I would stack my Kellys on top of each other. You're not going to have room to have all of your instruments laid out in a single layer a lot of times when you're doing a case. All right, so that's enough to get me started for this case. I'm going to go ahead and all of these cords and everything, I'm going to leave them here, but I'm going to grab my light handle, my cautery cord, and this other little cautery cord, and I'm just going to set them on top of this, and then I'm going to get, I guess, 2 Raytec sponges because they're going to use Raytec in the beginning of a laparoscopic case. So I'm going to set that there. So that way, once we get the patient draped, I can pull that Mayo stand up and they've got everything they need to start the case. Okay? So this table's done. My Mayo stand's done. Now I got to go arrange my drapes. Remember I told you we're going to have this laparoscopic or laparotomy drape. This drape has a little picture on it with a man. It's showing you which direction the drape goes. So you can see there's a little head right here. So that means the head of the patient, this part of the drape goes towards the head of the patient. See the little dude? All right, my patient's head is going to be right there. So when I lay this drape back here on my table, I'm going to lay it with the head facing where his head's going to be. All right. Then I told you you're going to have this drape. It's a large sheet or just a drape sheet. This is going to cover the patient's legs. I'm just going to lay it there on top of that because that's going to be the next to the last thing I put down. Then I've got to, oh, I forgot my towel clips. I got to make 4 cuff towels. These towels are folded in a way that you should be able to get your fingers and run it down. No, they're not. These aren't. All right. You're going to straighten them all the way out, make a little cuff on them, and fold them in half. So you got to have 4 of those. Little cuff, fold it in half. I'm not going to have enough towels. Fold it in half. You see I've got all of my cuffs facing the same direction. I'm not putting stuff there all willy-nilly. Oh, these you pull the corners like that and it opens out and folds. All right, I forgot to get my towel clips when I was over here, so I'm going to come over here and get these 4 biting towel clips, and I'll take them over here and put them on top of those drapes.
Do they know why you didn't take them from your large lap?
No, I haven't told them that. So I didn't take them from my large lap because at the end of the case, if we didn't have to open the skeleton, remember I told y'all we were setting up for a possible open. If we didn't have to open, when the case is over, the only instruments and stuff I'm going to have to count are those laparoscopic instruments. I won't have to count all of these large lap instruments. So I wanted to take my towel clips from the laparoscopic set instead of the large lap. All right, so I've got my surgeon's gown. Here's his gloves. I'm sticking underneath his gown. Gonna set that there, and what would go on top of this? A towel for me to give him when he comes in. A lot of them aren't scrubbing their hands with water. They're using the Avogard, which is the waterless scrub. If they're doing that, do I have to hand them a towel? No. All right, so that's it for the Skills Lab.